Hello to all of our audience, including potential impact and angel investors, donors, social responsibility corporations, and funding agencies. This pitch deck is to draw your attention to the much-needed and dear global need to fund and perform surgical interventions where they are most needed. This is to introduce to you TMX.care. TMX.care is powered by TeleMedicX. Our mission is simply to empower local healthcare systems by delivering quick, cost-effective, high-quality medical care and surgical interventions to patients globally. Our passion stems from many personal stories and fueled by Nuala Babidi's own personal injury accident when paragliding in France. Nur is our Chief Executive Officer. The founders at TeleMedicX identified a significant social issue or social problem in low and middle income countries, specifically in sub-Saharan African countries, where many patients are not able to receive surgical interventions needed because general and specialty surgeons are not available locally. This disrupts the recovery process and reduces patients' quality of life. The problem persists with no affordable solutions. This is due to limited training opportunities or challenges in allocating time for training, or due to a shortage of personnel and lack of funding to hire and retain surgeons. Our solution is not to compete with any existing mission, but to complement this significant need. Our founders are proposing to build a world-class team and a network of hospitals to join our platform and offer surgical interventions in sub-Saharan African countries and small island countries, where this service is much needed to save lives. Our operating model is two-tiered. In the realm of surgical interventions, we offer flexibility through two distinctive tracks: fast track and regular track service. First is our fast track. Fast track option is considered an affordable excellence option. This track is a discounted, cost-effective alternative ensuring quality surgical services, not exceeding $5,000 per patient or surgery. Fast-tracking access to vital interventions depending on finances and severity of the case. Second is our regular track option. This is donor-funded, where we act in service as implementers on behalf of donors, be it foreign governments, foundations, or private entities committed to corporate social responsibility. This option aims for widespread impact and accessibility. Our solution includes the following. 1. Platform testing. Our digital infrastructure is undergoing rigorous testing, gearing up for a seamless launch. The TMX.care platform is not just a solution. It's an innovation in motion, transforming surgical accessibility. 2. A workflow created to enable local surgeons to request general and specialty surgery. 3. Define the pre-operative phase to be conducted virtually. 4. Propose that surgeons travel to the host country to provide specialty service. 5. Offering skill development trainings. Our commitment extends beyond offering local surgical interventions with the help of local surgeons. To develop and design, offer skill development training sessions for capacity building, empowerment, and self-indoctrination. 6. Country managers to meet the driving force behind our medical mission. We have dedicated country managers, carefully selected to support and lead initiatives in our target regions. They orchestrate the intricate details, ensuring seamless collaboration and success. Throughout the virtual pathways of pre- and post-operative phases, and the in-person surgical intervention services, TMX contracted surgeons will also provide monitoring and mentoring to the host country surgeons and their teams to enable them to conduct these surgeries independently in the future. We stress on this point, as it is our intention to serve and build local capacities.
Our milestones include the following. 1. Funding. We've secured our initial stride with a pre-seed funding of $100,000, propelling telemedicine projects in the state of Hawaii. This is a testament to confidence in our mission and a foundation for future breakthroughs. 2. Platform testing. Our digital infrastructure is undergoing rigorous testing, gearing up for a seamless launch. The TMX.care platform is not just a solution. It's an innovation in motion, transforming surgical accessibility. 3. Board and staff recruitment. Building a formidable team is our cornerstone. A board of directors has been recruited. 4. Our startup staff is carefully chosen, ready to steer telemedicine towards success. The essence lies in the collective expertise propelling our vision. 5. Identified countries. With strategic foresight, we've identified the initial trio: Ghana, Mauritania, and Sierra Leone. These nations are not just locations. They are canvases where our impact will unfold, addressing surgical disparities. 6. Recruitment of first surgical team. Our inaugural surgical team is now in place. A blend of skill, compassion, and commitment. These surgeons signify more than just professionals. They embody the pioneers of social positive change. 7. Second surgical team has been identified, and conversation is ongoing.
Now, let's consider the target market. Global surgery opportunities and global surgery statistics. Let's dive into the heart of a significant global healthcare challenge. The Lancet Commission on Global Surgery of 2030 revealed a staggering numbers of 5 billion people lacking access to safe surgical and anesthesia care. The urgency to bridge this gap has never been more apparent. Our focus is laser-sharp, addressing regions where the need for surgical interventions is most acute. From sub-Saharan African to low- and middle-income countries, and even small island nations. TMX.care, powered by TeleMedicX, is positioned to make an impactful difference. Our Chief Medical Officer, Dr. Rashid Massoud, will be actively engaged in identifying the type and severity of all cases needing interventional surgeries. The total addressable market in West Sub-Saharan Africa is addressed by the surgical need, which is staggering. Reported statistics showed that 6,495 surgeries per 100,000 population are needed annually. The unmet demand is even more telling, with 5,625 cases per 100,000 population annually. In just the Western Sub-Saharan African countries alone. For Ghana, for example, this translates into nearly 2 million surgeries needed annually. It's not just a market. It's an ocean of untapped potential to serve and be on the forefront of impacting humanity on a global scale. Using the country of Ghana as a case study. And as mentioned earlier, the total addressable market translates into nearly 2 million surgeries needed annually. The serviceable addressable market, known as SAM, focuses on the surgical care from injuries alone. SAM in Ghana equates to 1,360,000 surgeries. We're strategically aligning with the pressing needs, ensuring our impact reaches the heart of healthcare deficits. SOM is the serviceable obtainable market. Our goal isn't just a number. It's about 3 surgeries per day, 15 per week, 60 per month, and a transformative 720 surgeries annually. This isn't just a projected market share. It's a commitment to tangible, life-changing interventions. We plan to focus our startup package with general and specialty surgical interventions in sub-Saharan African countries and small island countries, where the need is significant. Examples of countries include Ghana, Mauritania, and Sierra Leone.
The marketing plan will be devised at the country level, depending on the needs assessment, existing connections in specific countries, and on our ability to implement. Our Chief Operating Officer, Dr. Hadi Daniwi, will be working closely with our assigned in-country managers.
We plan on reaching out to potential healthcare institutions, both as providers and at the receiving end, to sign them up in our global platform. We aim to seek high-quality providers, research all opportunities, address concerns, and meet our needs. Our work plan has no room for any competition. As such, we plan to collaborate and work with like-minded missions and operating models to provide the best humanitarian relief as possible. Meet our founders. Nulaba Bedi, our Chief Executive Officer. Rebecca Miestas, co-founder. Dr. Rashid Massoud, our Chief Medical Officer. Dr. Hadi Dinawi, our Chief Operating Officer. Please contact us if you have any questions. Thank you for your time, and we look forward to working with you.